I want to highlight some of what you all saw in the video. We have Dr. Cutts here. We have our partners for CAPC. Our Safe Sleep program has been incredible, not only in preventing sleep-related deaths for Black children, but because of what we did for Black children, every single child that is born here in Sacramento County, before they leave the hospital, their caregivers are educated to safe sleep. So we don't just say this to say, but when Black children win, everybody wins. Ms. Tina often says, when we invest in our Black families, when we invest in our Black children and the most marginalized, we are indirectly investing in every single person around. And so it makes us proud to be a part of that work and to see it through. All right. Exciting, exciting, exciting. I'm excited about this network. I'm excited that we are growing. I hope you heard me say growing, right? Like we haven't stopped. This is something that has started. We're celebrating 10 years of something that is incredibly dynamic and life-changing, but it is fluid. It's dynamic. It continues to grow. And we continue to last another 10 years, another 20 years. And Chet often says, well, we'd be okay if we didn't have to do the work. So if Black children don't die, we're fine. We'll stop it. But until then, we're happy to continue the progress here in Sacramento County. I'm excited for us to hear from our community, from your peers. And so I have the honor to present to you our panelists, our panel and panelists. So first and foremost, I'd like to present our panel moderator. Oh, Dr. Woods, hey. I was looking for, like, where are you? Dr. Natalie Woods served for many years with the steering committee. Before I even came to the center at Sierra Health Foundation, I didn't know what Dr. Natalie Woods looked like, but I had heard of her impact. And so we're super excited to have her here and to support the conversation. So y'all help me give her a real celebratory 10-year welcome. And then we have my boss, and it's so exciting, right, to just be in this space when you get to learn from a giant, not only from what they do, but who they are, right? And so I'm super excited to get to introduce to y'all, probably not, because everybody knows him in the room, but my CEO, Chet P. Hewitt, who also chairs the vaccine committee. So we're excited to have you. Y'all can do better than that. Yeah. I'm looking at this list and everybody is a mentor. So next, I have beloved, just incredible example of grace and truth. And so I'm excited to introduce to you Kim Williams. Director of Sacramento Building Health Communities and CIL lead of Fruitridge Stockton. Just keeps getting better and better. Mr. Roberts, did you pay them to have your name be towards the end? Okay. We have Mr. Daryl Roberts, founder and CEO of Roberts Family Development Center, the leader, co-leader of the CIL in North Sacramento. I know better. North Sacramento, Del Paso Heights. Y'all give it up for Mr. Roberts. And then last but certainly not least, we have County Supervisor Phil Serna. We saw in this video, I don't know, you have to see it. The love for this movement and the love for this work runs deep. And he has championed this work from the very beginning, so we are incredibly excited to have him today. Dr. Woods, do you have a mic? You don't? Okay, I'll give you my mic and I'll hand things over to you. Y'all give it up for our panel.
I don't know about all of you, but that video was just so moving and inspiring. Thank you for the team that pulled that together. I am so honored to be here with you this evening. This is an amazing celebration, and you know, I would not have missed it, and it's exciting that. Oh, yeah, see, I couldn't hear you. Thank you. I feel like home. This is a reunion to me. Thank you so much. I've been retired. This is my 4th year of retirement.
All right.
You know, when we began this unprecedented work, we really had to help everyone understand what the Black Child Legacy Campaign was and what it was not, right? And so we were very clear, this is a community-driven movement. It's not just a program. And so with that, it was important for us to go into the community, not to just sit in a room and come up with what we thought would work, but to actually go into the community and talk with individuals. And it was very clear by their questions. They were very clear with us. Don't come in here with another program, and when you implement the program and the funding is gone, that you check it off your box that you did it, and then you leave. They truly were holding us accountable to what we said we would do. And here we are, 10 years later, BCLC strong. So I'm so proud of all of you and all the work that we knew that we had no option but to sustain this work. And also, failure was not an option for us. So with that, we just want to share with you just a snapshot of some of our thoughts as we have been along this journey. So I'm going to start off with our first question. So this is directed to Supervisor Serna. You know, you have been such a key leader and instrumental in the spearheading of this work. And as you could all see on the video, the role was extremely powerful in getting this work done. And as I recall, after reviewing decades of data, you asked a very important question that helped us begin this work. So will you just take us back to the beginning and tell us that moment? You know, what was the moment or the realization that made you believe that Sacramento needed a different type of approach to addressing the crisis? And I recall it was a crisis here for African American child. Yes.
First of all, I want to welcome you back. And this is a room full of people, a day that we're collectively, reflecting on the most genuine community effort I've ever had the privilege of being part of. To answer your question, let me start with a question that was asked of me not 10 or 11 years ago, but just today. Someone asked me, what is it about your job, your position as an elected local leader that you enjoy the most, that you cherish the most? And the way I answered it was to be fairly general, but it was to know that you can empower others,
Yes.
right? And especially empowering others that don't historically, traditionally have the kind of voice that you think they deserve. So I saw that moment back in 2011 as a freshman supervisor with all of 4 months under my belt during my first term, hearing from our child death review team in chambers, in public, during the course of a public meeting, what the board would hear and does hear every year, which is understanding not just the statistics, but the circumstance of every single child death that happened in the previous year. In 2011, we happened to not just have the annual child death information presented to us publicly, but we had a compilation of a decade's worth of those annual reports. So we actually had trend data to look back and actually look and see what jumped off the page. And for someone that was brand new to elective office, local government, and hearing what I was hearing, seeing what I was seeing, looking at everything from heat maps that we've all I'm very familiar with. Those became the 7 communities where all this great work is really focused here in Sacramento County. But it wasn't the data that was critical for me in terms of just helping to ignite this effort. It was the response when I asked the question, so what has Sacramento County been doing to address this crisis? And it was crickets, right? And it was something I'll never forget, and kind of the looks on people's faces, whether it was staff or my colleagues or people that were in chambers for a different item altogether. It felt like we almost psychically kind of all of a sudden just had an aha moment, like, wow, how can we as a local government, as a community, receive this information every single year and then understand that there was no concerted, thoughtful effort to address what I argue, and others certainly join, is the reason why we have partnership between your elected people and the people that are elected to represent. And so I played just a very, very small part of this just by, I think, asking that question at the right time with the right people in the room. And it was not going to be satisfactory to anyone, certainly not to me. And that was the day that I felt that we had to not just check the box, as you say, by receiving the information, but do something about it. And so that was really kind of the moment that precipitated this great work.
Well, thank you, and thank you for asking that question. Thank you. So, Chet, just so you know, I am going to just say that I've always admired you as a leader, and it was such a joy serving with you. You've been a long-standing chair of the steering committee, and your team has always stepped into those spaces that others would not necessarily step into. So thank you for addressing issues, critical issues here in our community. So BCLC was built on a philosophy that is centered on community power, the social determinants of health, and targeted universalism. So will you share with us, how was this approach for this work chosen, and what makes it different from traditional government programs?
Thank you, Natalie. It's really good to see you again. Natalie served as the co-chair, and just seeing you just reminded me of a number of other folks whose names I just take a minute to call out. Like Miss Wendy Petco,
Yeah.
first co-chair. See those pictures, this brings back so many important things. And, Robert Phillips, who worked with the foundation for many years. And now with the Health Center in Oakland. Of course, Kendra Montgomery Block. We hired people to do that. And then a staff person who made all that happen in the background, Miss Madeline Sabatini. I also want to thank Phil because, the old adage that the most powerful form of speech is a question was proven true by your courage to ask that question. Because it would have been easy just to get the data for the 21st year and not say anything else and let it go by. So I like to think that, you and I are forever connected by a simple question, which resulted in 10 years of extraordinary work. So I think that proves the point. For us, this notion of, target universalism really comes from the great John Powell.
Yes.
Who talks about, the impact of othering people.
Yeah.
Those other people, however you want to define it. And of course, the notion that if you target a challenge, and you do it with the kind of heart and head and energy, and a value system that really is trying to improve the conditions in which people live.
Yeah.
To come out to work like we are all humanists, not elected officials, not foundation leaders, but people who authentically care about the plight of other people. That you can really do extraordinary things. We targeted Black children because dying at 2 or 3 times the rate is just unacceptable. And as someone said in the video, Ms. Tina, preventable causes.
Yeah.
There are certain things you can't do anything about, and there are certain things that you actually can. So that was really at the heart of our work, and knowing that no system, not First Five, not Sierra Health, not Department of Children and Families, great Michelle Gallegos, who helped lead this work, along with Kim Pearson and others, that none of us could do it on our own. Humbleness as opposed to hubris.
Right.
That we have to work together to make it happen. Right? And at the end of that the notion of being able to impact populations beyond just the African American community, for me, is one of the most beautiful things about this work. Because I can walk into Miss Jackie's office, and there are all kinds of people there. No one is ever turned away. But the emphasis and focus for us has always been on the problem that got us started. I'll end by saying I had the privilege of sitting on the initial commission, the Blue Ribbon Commission, that Phil put together that actually moved through the research with folks like Linda Vaughn and others who really helped set the base for this to actually happen, along with the great Grandma Johnson, who sat on that body as well. So when we say we stand on the thinking and the shoulders of other folks who have been at this work, whether it was BCLC specifically or others, it's not only some pithy thing to say, it is truth. And at the end of the day, I think what we all know is that without community, it would have been a lot of great work and writing, but it wouldn't have had the impact that it actually had.
So, Mr. Roberts, I'm coming to you. And I also just want to acknowledge what an amazing leader you have been. Your organization has been a cornerstone in your community, so thank you for the work that you do. So the Black Child Legacy Campaign intentionally invested in local organizations rather than creating new institutions to do this work. So why do you think this was an important choice? And in your opinion, how did that impact the outcomes?
First of all, thank you. Thank you all for coming. 10 years is a long time, but it also represents a small window into the work that we've done for many of us beyond 10 years. For me, Black Child Legacy started almost 35 years ago in Oak Park.
Yes,
Basketball, through the Salvation Army, to Urban League, to Senior Academy,
Let's go.
to Kate Buchanan Elementary School,
Yeah.
meeting my wife. Best thing that happened to me. So the best organization, Black Child Legacy, is who we are. Our daily work is around the Black family, Black children, and the community. We don't apologize for it. We don't say, hey, we and others, yes, and others, but we focus on those who most need us.
Exactly.
And we recognize that Black Child Legacy has had to do that and will continue to do that, regardless of what's happening nationally. And I think more than anything else, our organizations have gone through the test of time to the point that people recognize that we're genuine, that we're real. And one of the reasons that I think that Black Child Legacy has benefited in each of those communities is that the organizations selected were part of the community. We were in North Sac for past 15 years when we were tapped to lead Black Child Legacy. We had partners like the Urban League, partners like Mutual Sister Network, who didn't take responsibility for Del Paso Life North Sacramento, but they were part of it. They took on other responsibilities at Oak Park and Arden Arcade. But our community benefited from those organizations and their commitment. Today, as we talk about the work that we do, it continues to be just that. We put our head down, we do the work. But we also recognize, for us, you saw our Freedom School work. Freedom School is a part of Roberts Family Development Center, which is part of Black Child Legacy. It's intertwined. There is no separation because our work is not separated by anything other than the fact we're committed. The people who are part of Roberts Family Development Center and the organizations that are in the other 6 neighborhoods are just that. That's the common denominator. People are committed. They're committed to the work, they're committed to people, they're committed to the cause. They're committed to Black child legacy.
So Ms. Williams, you too have been an amazing leader in the community, and you've been doing this work for quite some time. Although you don't look like it. So, you know, your work has been tireless, and the work as a community incubator lead has been incredible. So it's remarkable success that the 7 incubator leads, as just referred to, are still the anchors of this collaborative 10 years later. That's no small feat. The CILs are at the heart of this work, so tell us, what has it taken to sustain the BCLC structure and also the momentum?
You know, I think, thank you. This work has been, I think in my counterparts out there, y'all can tell me if I'm wrong, but every CIL lead that I know and have a relationship with, and when we walked into this work, it is because the passion and commitment that they have for Black children is unparalleled. And they've been doing the work for so long. We kind of stopped and said, it's about time y'all paid attention.
Right.
Because we've been doing this with nothing, with pennies. And so coming together under Black Child Legacy as the 7 sites, what it allowed us to do, yes, it gave us resources and we're very appreciative.
Right.
But it also helped us to be able to build a structure and a system that would work across silos. And so what happens now is that, you know, I've been in youth development work, you know, before I even got to Black Child Legacy, I spent 14 years in Boys and Girls Clubs. Before that, I was at Stay Home. And I've seen how on smaller levels, when you come together, how you can move mountains. But when you bring these 7 organizations together, what we're then able to do is turn the needle on children that are dying the other way.
Yes.
And we all were tired of our babies dying. Like, we don't want to turn the news on anymore. We didn't want to get any more emails. Help, we need this, we need that, because nobody was out there doing anything. So this also gave us the opportunity to put some systems in place that would support our families, that would support our children, but also that would support each other.
Yeah.
There's a connection. I can pick the phone up and call Miss Jackie at any time and ask her for some support, and she's gonna give that to me.
Yes.
You know, Pastor Les can call me and ask me for something, I'm gonna give that to them. You know, parents can call and say, I'm gonna give that. Danielle can call, I'm not naming all y'all. But it's like, but that's the kind of relationship we have. You know, it could be a text message, it could be a phone call, it could be an email, it doesn't matter. When one of us needs one of us, we're going to be there. And if you need all of us, we're going to be there. You gotta impact. We don't all by ourselves. And that's the reason why we're able to support. I mean, yes, we get families that might, you know, went to Mr. Roberts, come over to me, try to get something, went to the North area, but again, hey, do you have another work? Yeah, I just gave them this. Okay, thank you. You know, so we know, but we also understand sometimes the need is great.
Yes.
And you might have some families that did get support from all 7 of us, but that need might have been that great. And so what binds us together and why we're able to sustain is because A, we have each other. We have support, and I can't not talk about the relationship that we have with the county and our county board. Because you saw the report from the commission report. Our Black kids were done. County was doing it by themselves, it wasn't working. We were doing it by ourselves, it wasn't working. It wasn't until we came together.
Right.
And the foundation said, let us convene these groups together and say, if we work in unison with each other and we support each other, we can make a difference. And as we begin to do that, that is when you begin to see things change. That is when, you know, like I said, people can walk in off the street and there's somebody there, there's a DHA worker right there. Right? They don't have to try to travel there and get on a bus, they can come right there. That's unprecedented. And because you now have services in those communities, people now know where to go. And again, other people have come in the door, and we're going to serve anybody that walks through the door, but we are unapologetically serving our Black families.
Come on.
We won't apologize for that. We won't change that. I don't care what the federal government says. We serve a Black family. is really what sustains us and helps us to move the work forward.
Targeted focus. Thank you so much. So we're talking to our CIL, so I'm gonna come back to the two of you, right? So the Roberts Family Development Center and SAC BHC were chosen as community incubator leads because of the deeply rooted and long-standing relationships and trust that you've already established, and you've just talked about that. So coming together across neighborhoods is definitely a hallmark in this campaign. So share with us, what did it look like early on, and how have you continued to lead individual organizations while maintaining the complexities of the deeply connected BCLC network? So you tapped on that a little bit, but I also want to give Mr. Roberts an opportunity to respond to that.
I look at the pandemic. I think about the pandemic in terms of relationships and partnerships. Because remember when that occurred, we were some of the only organizations in the communities that we serve that were still open.
Right.
People don't realize what we committed ourselves to doing at that time. Other folks were closed down and they didn't know what was going on, but we were so committed to working with our community, our neighbors, our families, that we and our staffs and the people who supported us went about the business of doing the work that allowed us to survive. Other neighborhoods, other cities didn't have this. And I'll tell you, it was a partnership across the line. Again, for us in North Sac, whether it be the Urban League, whether it be Mutual System Network, whether it be others who came and became a partner, whether we were serving CV Circle or wherever we were at, it required us all to work together. And that's the part I remember about this work. Whenever it gets really tiring, I do get a call from one of you. Say thanks. I also will tell you, and I'm looking at it right now, we have had young people who started with us and have grown to lead their own organization and lead other initiatives. And for us, it's a great thing. Those are, to me, proofs that the work being done at that time often was done by them. And people don't always recognize it. People don't always talk about that. But it's really important to me that we talk about those partnerships and how that continued throughout the toughest time till today. And today, as we do this work, I think it just requires us to continue to communicate, to continue to talk about it. I think it's Randy Missouri put out a message the other day that everybody knows. We're talking about SNAP. She's talking about what are we going to do about our families, and all of us are impacted by what's happening. That's the leadership that has developed through the Black Child Legacy Initiative.
That's amazing. Thank you for sharing that. It just made me remember that during the pandemic, or right when we were coming out of the pandemic, I was at a friend's house in the Valley High area. And someone came knocking on her door. And when she came back to the room, she said, "Oh, that was my CIL. They came by to bring food. They came by just to check in." So again, just a great testimony to the work that the CIL is doing. So, this is a two-part question. So what makes the relationship between county government and community leaders work in BCLC? And then why is it so important right now to get public and private partnerships right?
Well, the simple, easy answer to the first question is trust, right? And I at least wanted to make it clear from where I sat at the time that the Blue Ribbon Commission was beginning its work in earnest, and then we had the establishment of the steering committee, that it cannot be an initiative that has been referenced quite a bit actually thus far this evening by one individual. It couldn't be a moment in time, it had to be a continuum. And so part of the message that I wanted to help present and hopefully be understood, and I think it's clearly been understood, is that this has to be a community-led effort. The good, the bad, the challenging, the the awards that we all seek in doing this work, it has to be owned by the community. And I think this is not just the case, it is the model. This is, in fact, Chet and others know this. When we started seeing the data come back from the early work of addressing those 4 leading causes of the most profound death rates in terms of disparity, I was talking to legislators in New York State who had heard about the work and wanted to know more. I was going to national conferences of county officials. They approached me wanting to know more about this thing called the RAACD at the time and Black Child Legacy. And it began to become easy for me to kind of recite what I think it is and why it's so critically important to our community. But I also would always conclude those conversations by saying it's easy to talk to a politician about it who again, simply just ask a question at a moment in time. It's really incumbent on you to understand that it's community-owned, it's community-led. It cannot be fleeting because of the presence of one individual or group. This is something that has to be so sustained that we're back on the stage 10 years from now, 20 years from now, and we're looking back on even more success. So for me, that has been the most critical part of the entire initiative, is that it has to be community focused, yes, but it has to be something that is championed by, as many people like to say, boots on the ground.
I completely agree with Supervisor. Trust was at the heart of this particular work, but I say also a whole lot of grace. Because as someone who's been around since the very beginning, I'll just tell you, it was not always easy. And I've heard more complaints about things that have not gone right than I care to share in this celebration today. I will also say, though, that all those things are minor when you compare them to all the success and the impact that we have actually had. But it is really worth noting that one of the most incredible things about the network that was built is that when things went wrong, we really worked hard to figure out how to get them going right again. Because there was no model for us. This had not been done before. We weren't creating or following somebody else's roadmap. We were building one of our own. And that's what was incredibly unique about this. I'd also say that, that network that we have now will be important, because part of your question was, why is it so important to get these partnerships right? Because things are about to get worse. And as several folks have said, when things happen that were not germane to the creation of BCLC, like the pandemic, BCLC was not built to address a pandemic. But where did folks go when they needed to get tested? Where did folks go when they had questions about the vaccine and whether it was worth taking? Where did folks go when they needed food?
Come on, Jack.
They used those very same networks. If we didn't have it, we'd be working fiercely to try to build it.
Right.
And I think one of the big benefits of our work is that we need to build similar networks for other communities as well. Build off the success of the Black Child Legacy campaign. And for me, that idea, that grand idea about how could this work for other groups and other communities is really important. Because there's one thing I know about the folks that I've gotten to meet in this audience, is that we really love all children.
Yes, we do.
We love all children. No, we're not, as my colleague said, we're not unapologetic about it being focused on Black children. Not at all. But we really do love all children.
Yes.
And we really do believe all children deserve the benefit of being able to thrive and live healthy lives. All families in all communities need that today. And some of the ugly things that we're seeing, to me, suggest that we're gonna have to pull together even more deeply for what's coming our way in the months ahead.
I think that was a mic